Got a scar? Let's talk about it. So as a plastic surgeon, I deal a lot with scars. We plastic surgeons, as opposed to other kinds of surgeons, make big external scars. And because we do, we all want to make sure that those scars look as good as possible. And you do too. So let's break down scars, how to take care of them when they're new scars and fresh scars, and what to do if they get a little bit out of hand. So there are 4 S's for a good scar: sun protection, scar massage, scar moisturization, and silicone tape. The last 2 are very similar, and most patients have an option of either, so let's break down each one of them. Sun protection. So scars, when they get exposed to the sun and they're new scars, attract sunlight and absorb sunlight even more than normal skin does. So what can happen, especially in darker folks, in black and brown folks, is that the scar itself will get hyperpigmented, meaning it gets darker. That hyperpigmentation is actually really, really difficult to change once it's there. And so the best way to treat it is just to avoid it to begin with. If you're gonna go out into the sun with a new scar, make sure that scar is either well covered, or by clothing, or is well covered by sunscreen, with at least an SPF of 30 or greater. Do this religiously, do this multiple times a day. Do it even if you're indoors but are exposed to sunlight from the outside. Scar massage. So scars, as they're freshly healing, can end up being a buildup of tissue. That tissue can get thick and it can get a little hard as well. So the best way to achieve a good scar, a nice smooth scar, and avoid some things like hypertrophy of the scar or even keloids, is to begin massage early. You can massage in any direction that you want to, apply as much pressure as you can tolerate to begin with, and do it frequently. I tell my patients ideally 5 times a day for 5 minutes each day, but the idea is just to do it frequently throughout the day. And you do it for the first 6 months. The first 6 months to a year of a scar are when we really see scar healing and scar maturation. So most of these changes that happen up until that point. And so you want to be interacting with your scar by massaging it, keeping it well moisturized, as we'll discuss in a second, for at least the first 6 months, if not the first full year. Now, scar moisturization. Scars heal best in moist environments. Not wet, not dry, but moist. So when I say you have a choice of scar moisturization or silicone tape, here's what I mean. You can keep the scar well moisturized by applying a nice, thick, moisturizing cream. My favorite, and I hope Aquaphor sees this and wants to give me some money, but my favorite is Aquaphor. It's in the lotion aisle and it's great. I use it for everything. I use it for dry elbows and knees. I use it for just dry skin, period. I use it for scars. I use it almost daily. Well, actually more than daily. I use it frequently. Other similar types are, but not as good. I love you, Aquaphor. Love me back, okay? Eucerin, CeraVe, Cetaphil, any good thick moisturizer would do. Even some Vaseline is better than nothing. Can you use things like vitamin E oil and aloe? Absolutely. The idea is just to keep the scar well moisturized. And the reason why I like a good thick moisturizer like Aquaphor is is that because it's thicker, it tends to last longer. Some of these thinner creams tend to evaporate sooner, and so you don't get as much of a benefit from them. That being said, it can also be a little greasy sometimes to have Aquaphor on. and so you might choose to use a thinner moisturizer, but if you do, then put it on more frequently. The other option again is silicone tape. Silicone tape works well for long incisions, breast scars, tummy scars, things like that. Silicone tape usually comes in a spool. You can just cut it to the length of the incision, put it on the incision, and leave it on all day. You only take it off to shower. And you can actually reuse it by washing it in the shower and hanging it to dry to wear the next day. What does silicone tape do? So it does much of the same as Aquaphor. It keeps the scar well moisturized. People also think that it applies a little bit of pressure on the scar and so helps to keep it flat, like, combining it with scar massage. So again, do all of these things religiously, at least for the first 6 months, and then you can taper off after that. And hopefully by then, you'll have a great looking scar. But what if you don't? What if you are black and brown and you are prone to either keloids or scar hypertrophy? So once you reach that stage, it's really hard to dial back the clock, especially keloids. Keloids want to recur or come back after they are removed, treated. So really, again, the best medicine is preventative medicine, but if you can't do that, let's discuss some ways that you can treat them. Now, I should stop here and say scar hypertrophy and keloids are really along the same spectrum. Scar hypertrophy just means that the scar gets a little bit raised, but it doesn't get kind of out of bounds of the scar itself, right? A keloid, on the other hand, can get pretty out of control, and I've seen some really, really huge ones, angry ones. Keloids can be painful because they're growing without really getting checked. They can be itchy, and they just can really cause discomfort from how big they are. So to treat a keloid, and scar hypertrophy is much the same in terms of treatment, but it's really important for these things to be true for keloid treatment, is that you really want to use more than one modality, right? So the treatments for keloids include just removing them, injecting them with steroids or other kind of what we call anti-neoplastic medication, radiation, and laser therapy. Now, radiation has, for the most part, fallen out of favor. I still use it for patients who have really, really refractory keloids to treatment. But radiation, while good, because it kind of stops cell proliferation, which is what happens during keloid development, it can also make you more prone to have cancer later on in that same area. So again, I really, really selectively use it for only people who have these really giant keloids that they've tried to excise or they've tried to treat other ways and they really, really couldn't get it done. So with these 4 modalities, you want to combine at least 2 of them, right? So you can start with injecting them with a steroid or with my favorites, 5-fluorouracil. It was initially developed for cancer, but really works well for keloids, because cancers and keloids kind of act the same way. They just kind of divide cells over and over again without the normal check from the body to say, hey, we have enough cells, stop producing, right? The only difference is that cancers can become invasive and keloids present outwards, externally. But they act the same way, and so that's why 5-fluorouracil is such a good drug to use. It also works a little bit better than steroid because you don't have some of the side effects of using injectable steroids. Meaning that with steroids you can get what's called atrophy of the scar if you inject a little bit too much of the steroid, which means that you don't have the raising of the scar, but you instead have a depression, which can be just as distressing as having a raised scar. But with 5-fluorouracil, you don't really see that. So you can inject them, you can again excise them, and then there's laser therapy. So for laser therapy, what you are asking your dermatologist or your plastic surgeon is to use either microneedling or a fractional laser. The idea being that you're creating little pores in the dermis, in the skin, and asking the skin or demanding of the skin to grow in a more organized fashion. I also combine the laser in what's called a laser-assisted drug delivery, meaning that I use laser, the fractional laser or microneedling, and then I add a topical 5-fluorouracil to get that double whammy of providing the medication that you need to help stop the keloid progression, and also kind of inviting the skin to better organize as it continues to heal. So again, this is what we would do if you have a keloid or if you just have a hypertrophic scar that is still as bothersome, still as distressing. Does insurance pay for this? For the most part. It's a little bit harder to get the laser approved, but we can get it approved, and I've been able to get it approved. And so it really is about talking to your plastic surgeon and dermatologist to figure out what modalities are good for you for a keloid. What are your thoughts? What have you tried? Or what are you going to do in the future? Leave your comments and questions below, and as always, oh, and subscribe. I forgot, almost. And as always, love you lots, and bye for now.